Hi guys, can you all see me? Can you all hear me? Good evening. So I'll be starting with the questions posted on the WhatsApp group first. If you guys can hear me, just let me know, write in the comments please. Okay, I can see. Hi, yeah, ma'am. Yes. Okay, fine. So you can hear me, correct? Let's start. Okay, I'm starting the questions from the start of the chat today when I opened in the WhatsApp group. First thing, somebody asked me, I'm migrating to Australia on study visa. Can I register with ADC for initial assessment side by side before migrating? See, my honest opinion, you should start studying once your initial assessment gets approved by ADC. Okay? Once all your documents are cleared and you have the approval, then you are sure that you will be giving an exam. That is when you start studying for it, and you need minimum 4 months. Minimum 4 months, 4 hours a day, which means if you have less time, you start even more early, and if you can devote more time, like 5-6 hours, still you start 4 months before. Is that clear? I hope no more again this question shall be asked. Anybody who doesn't know the WhatsApp group, please email me on adcwrittenmocktest@gmail.com. I will send you the link of the WhatsApp group and then you can get added. Will it cause any trouble in my immigration process since I'm coming on a study visa and at the same time I'm registering with ADC as well? Immigration and ADC are two different things. They are not linked to each other. Your immigration is dependent on completely different things. You are not a registered dentist so far in ADC, so that is not going to be taken into consideration. Plus, all the immigration related questions, please ask the immigration specialist. Like, I'm not an immigration specialist, but as per my understanding, this is what I feel it is. Okay, then, yeah, what is this question? I need a study partner. Please answer my question. What does a study partner will do? I'll give you a minute. Answer this question. What will a study partner do and what are you planning to study with them? I want an answer to this question. Like almost like 20 times this question has been asked. I need a study partner. My question is, how are you going to study with your study partner? What are you going to study with your study partner? Please answer this question. Nobody is answering this question. How do you plan to study with your study partner? No answer? Then stop asking this question. Because you cannot study with a study partner in this. How exactly do you plan to study with a study partner? I don't understand. I can have 10 people giving ADC exam. How am I supposed to study with them? It is not a theory-based exam, as in you're not supposed to write paragraphs. It's not a Viva-based exam that you can share your knowledge. It's a concept-based exam. See guys, you have to understand what is this ADC exam about. It is not asking you to give paragraphs, or it is not asking you to explain why a particular disease has been caused, how it looks in the patient's mouth. No. It has already described you a scenario. ADC exam is a very intellectual based exam. It is not a mug up exam. It's giving you a life scenario, and this is what the clinical practice is about. A live patient comes and he gives you all the signs and symptoms. You are supposed to give a diagnosis. You are supposed to give a treatment planning. You are supposed to filter out options of treatment planning if the patient is having some kind of a disease or some affected condition, or the patient is an addict, or the patient is taking some medication. Are you understanding my point? So what are you going to study with your study partner? Nothing. So forget. This is your intellectual. You focus on your intelligence, your focus of analysis. Having a study partner, if that partner is not clear in the concept, he's going to confuse you. Or he's going to take more time of you, or you're going to take more time of his intelligence, and it's going to be a waste and it will be frustration. That's it, nothing else. So any study partner thing should go out of your mind. Forget it. Alright. Now coming to the next question. Any other questions you all have, guys, before I proceed to something else? Hello ma'am, being a pediatric dentist, prosto is a nightmare for me. Can you please tell me from prosto what to read? I am also a pediatric dentist. Prosto was also a nightmare for me. But then you have to study. I studied it. I studied the important topics that we're going to ask. We'll come to the important topics in each subject that is going to be asked, okay? I'm again going back to the WhatsApp and reading the question. Okay. Somebody asked me about this BRONJ, MRONJ. Patient is taking what? Denosumab. So what condition they can have if an extraction is done? Correct? That was the question. Patient on bisphosphonates needs an extraction. Patient might have osteoradionecrosis, MRONJ, BMRONJ. Have you people read TG, therapeutic guidelines? If yes, then you wouldn't have been asking me this question. See, this is what I mean. Don't just read. Analyze and understand. Australian dental exam is not your girlfriend, boyfriend, husband or wife who says anything and you pretend that you are listening and doing what they are saying without understanding to maintain peace in your relationship. ADC exam is not that. You have to analyze and understand. So, on this question, I'm just going to read the paragraph from therapeutic guidelines and you people answer the question. Understood? If you would have read and understood, I've taken this therapeutic guidelines, 2019 version. For people who are asking me where to get this book, on this Facebook group, I have uploaded on live, on the file section. You can just go on the file section and download this book and the infection control book. Like I've just given out this book for free, just like that. Take it, read it. This is the gold standard. So I'm reading from this first paragraph of this page. Medication-related osteonecrosis of the jaw is an area of the exposed bone in the jaw persisting for more than 8 weeks. In a patient currently or previously treated with an anti-resorptive or anti-angiogenic drug. Anti-resorptive or anti-angiogenic. Anti-angiogenic means one who decreases the blood vessel growth. Who has not received a radiation therapy to the craniofacial region. Anti-resorptive drugs include bisphosphonates and denosumab. Now this is a very important line. Anti-resorptive drugs include bisphosphonates and denosumab. Anti-resorptive, ARONJ, that is anti-resorptive. What does it fall inside? MRONJ, that is medication-related osteonecrosis of the jaw. So medication-related, that is MRONJ, is a general term. ARONJ is a specialty, like dentistry is a general term, pediatric dentistry, prosthetic dentistry is a specialty. So if somebody is going to ask for whom am I supposed to go for crowns and bridges, and the option gives you dentist, prosthodontist, because they have given the specialist, you will choose the answer as prosthodontist. Is dentistry correct? Yes, it is correct, but there is a more specific term. Similarly, MRONJ is a general term. If they are giving you ARONJ, then that becomes your answer. If they are giving you BRONJ, that is bisphosphonate related, and the question says the patient is taking bisphosphonate, then BRONJ further becomes a specialization. Are you understanding my point? Like there is dentistry, there is pathology, and there is forensic dentistry, which is even more specialized version of pathology. So now I'm giving you a specific example. Patient is taking bisphosphonates and I'm giving you the option of MRONJ, ARONJ, BRONJ. Your answer should become what? BRONJ. You understand? ARONJ and MRONJ is also correct. But if I'm giving you the specific answer, you're supposed to choose that. Then you cannot be confused. What should I choose? If you read this paragraph, this is just the third line on this page on the first paragraph. You should not have a doubt. So this is what I mean. You read, but what about analyzing and understanding the concept? This is more important. You just don't read, you understand, oh, this is a subspecialty. I hope this is clear. If it is clear, please message yes. I can move on. Guys, message something. I'm waiting for your comments. Yes. Okay, so I hope there will be no more doubts about this question. Alright, now coming to the next question. So many people who had attempted the exam said they failed in particular clusters, not all of them, and many of them failed in the professionalism cluster. After reading today's messages on WhatsApp, I'm not surprised. I'll tell you why. What does professionalism mean, guys? It's having a respect towards your own colleague, not screwing them up. You are not professional only when you're attempting the exam. You are also supposed to be professional in general. So all those people who have written on the WhatsApp, I have all the study materials, please contact me. I have so and so mentor study material and he's very expensive mentor, and so please contact me, I can give you the materials. Is that professional, guys? And then you say you failed in professionalism. So when you're not giving the exam, the professionalism is out of the window? No, it has to be imbibed inside you. ADC exam is not just attempting the right answer on the computer. It is you living for it. And then you people message me why you don't have a study group for all the candidates enrolled with you. This is why I don't have it, because this is what people resort to. They start selling off materials on the group. I'm surprised. With due respect to whatever mentor you are following and you have taken the materials from them, that mentor has done some hard work. You may or may not be happy with that mentor is another question. But you cannot just outspokenly say that, you know what, I have the material, give me some money and I'll give you off the material. If material could clear you, then you would have cleared the exam yourself. You bought the material, you did not clear. That's why you're messaging me in the group today that your concepts are not cleared. So clearly materials don't get you through. The understanding of the concept gets you through, like I just explained. That comes to the next question. The first question of today was, I would like to read out that question. I was so surprised that in spite of my so many videos, people still ask this question. Doctor, which kind of coaching and mentorship should I join? I have answered this question in my videos, but if you have not listened about it, or if you have joined any other mentor and still you're looking for further mentorship because you could not clear the exam, mentor will not get you through the exam. It's your understanding of the concepts that will. Try and understand. ADC is trying to get good clinicians. When I say good clinician, means good doctors, not trained dentists. There is a difference between the two terms. A trained dentist is one who can perform the task. A good doctor is the one who can analyze what a patient needs and doesn't need, even though the patient is asking for it. You understand? So to be a good doctor, you need to be very confident of your subject. It may take time for you to understand your concept, but it's okay. At least you know what you're doing is right and you will not screw up any person's life. You understand? So being a good doctor is knowing the subject properly. That has to come from your own reading. Analysis of the subject can be helped by frequent solving the questions. The exam pattern has changed. That's why I'm saying all this. Previous exam pattern was just attempting MCQs. So you could just mug up the MCQs and which would be asked in the exam. You attempt it and you pass the exam. That is what the current, all the Facebook mentors who had given the previous exams are still selling out the same materials. They have not given the current exam pattern. They don't know the questions. They get the questions only from the candidates. So they actually don't have an idea how it feels like to go in the exam and attempt this kind of scenario based questions. How will they guide you? Like, I really don't know. It's like learning to drive a car from a person who's never driven. How is he going to teach you? He's going to still stick to the previous materials because it's being sold off. He has a previous successful rate of candidates. Good for you. But you have to change if you have to teach the fresh batch of students because they are coming for the changed pattern of the exam. So when you're taking mass classes and you're sticking to a set of questions to solve, first of all, those questions may or may not be asked in the exam. Then you are currently wasting time in that mass classes. Secondly, you're not allowed to speak unless being asked to speak to. Then what is the point? Your weakness of certain topics may never be answered. And if the mentor is focusing on some topics which you already know, then you are wasting your time in listening to it. So just because you're attending somebody's coaching doesn't mean you're going to clear the exam because you're not hitting the correct spots. You need to understand what you need to know in the first place. What you know and what you don't know, and be having the freedom to ask things which you don't know. Are you understanding my point? Is that clear? Say something, guys. I'm waiting for your comments. Alright, so if you people have any questions, ask. Otherwise, I'll move on to certain questions that are asked on the WhatsApp group. You can write your question in the comment section. I'm reading it. Okay, then I'll move on. Nobody's asking me a question here on the comment section. So one of the question that was asked in the current exam, somebody has posted as a patient presented to you with a fractured upper anterior tooth. First line, fractured, so it's already diagnosed that it is fractured. He had this tooth endodontically treated a few years ago. So root canal is already done, meaning what? The tooth is non-vital. What is an important question to ask the patient? Pain, swelling, how fractured happened, and bleeding. If a patient is coming to me saying that my tooth fractured and it was root canal treated, what should be my first question as a doctor? Are you having any pain? Because that usually patients come to a dentist, usually, not always, usually, because they are having pain. So we need to understand from where the pain is coming. Is it actually related to that tooth or there is something else happening in that area? Because pain is an emergency. You cannot leave a patient in pain. You understand? Me asking, is there a swelling, is my next question, not my first question. How fractured happened is also my next question, not the first question. Bleeding is something which I will ask, but that would be on a low list of priority, but not my first question. I hope this answer is clear then. What investigation will help you gain valuable information? Now, very important question. What investigation? Now read the question again. It already says there is a fractured upper anterior tooth. So, what investigation? Probing, vitality, IOPA and percussion. Vitality? No, it's an endodontically treated tooth. What I will do checking the vitality. IOPA is a good answer. Probing is also a good answer. Percussion is not a good answer currently. it is in the list of investigations, but it's not a good answer because the question doesn't mention that the patient has pain on biting or something like that. So I'll be stuck with probing and vitality, probing and IOPA. If I have to choose one, I will go with IOPA because I will have to see where the fracture has happened. But if the question has mentioned that the tooth is fractured and it is seen on OPG, that means a radiograph has already been taken. Then my answer would be probing to see if there is any fracture from the side, or as in, can I probe the fracture? Is there a pocket? Because pocket is going to decide a lot of things in my treatment planning. You understand? Only a fracture depends where it is the stage of fracture. Can I treat it or can I not treat it? But if I'm probing and I get a pocket of 8 mm, I know this tooth has hopeless prognosis. I cannot treat it no matter what. So depending on the question, if the question has mentioned any radiograph, probing becomes my answer. It has not mentioned any radiograph, then IOPA becomes my answer. Is that understood? Can we see the fracture on radiograph? Yes, of course. Thank you, Zain. You're from Pakistan and you just want to appreciate my work. Thank you. Yeah, seriously. I mean, today I was just, going for some work and it was just hitting me like since morning I was getting so many messages, even when I had not on the comments on my WhatsApp group. Like a lot of people who couldn't clear the exam. Not my candidates, other people. From other mentors, they were like, Doctor, we are so confused and we failed in this cluster and when are you starting your course? So I was like, it's no point jumping from one course to another unless you think why you could not clear the exam. Like, what is the problem? So today's session is all about me understanding what is the problem, as in what are you not understanding? Is it the concepts, which subject concepts? What in general about the exam are you confused about? How was your exam? How did you feel about attempting it? What were your feelings after you gave the exam? I want to hear from you guys. You people should write in the comments telling me this is what you felt. Pour your hearts out. Let me understand. Then only I can help you, right? You want help from me. That's all you want, correct? So you have to tell me what exactly help you want. You cannot come confused. Okay, just help me. Help in what? Like, I cannot teach you dentistry. I cannot take classes saying, okay, today we are going to study prosthodontics. No, you have done it. You are a doctor. You are not a student anymore. So, but I understand some areas your concepts may not be cleared. So tell me, then I will tell you exactly what is needed, specific to the exam. I'm taking this effort so that you people don't feel lost, because you are feeling lost. And I think as a fellow colleague, if I can, I should help. This is professionalism, guys. Selfless professionalism, which is what should be imbibed in you. You have to change your attitude. Once you change your attitude, it automatically will reflect in your analysis of the question and you will clear the exam, inshallah. So tell me what you guys feel, and in the meanwhile, I'll read the next question that I should answer. Okay, I see some questions here. Ma'am, what is the primary diagnostic test for cracked tooth syndrome? Biting on a gutta percha. That is the primary test. So if your diagnosis is given that there is a cracked tooth syndrome, the classic sign is pain on biting and releasing the pressure on biting. That is your primary test. Could you please describe what kind of question is an information gathering cluster? Secret tip. All clusters have all the similar questions. There is no difference. Each cluster will have questions on professionalism, on infection control, on diagnosis, treatment, information gathering. I could not personally differentiate. If you give me any single question, I will not be able to say from which cluster it has been asked. I don't even know why they have given this cluster differentiation. There is literally no difference. Like, I could not find anything. Like, just I read out a question about a fracture in an endodontically treated tooth. I don't know in which cluster it is falling, because they may frame a question thinking this is information gathering, but when you read the sub questions, 5 of them, like I was explaining in my previous session, if you would, it's uploaded on YouTube and even here, I had mentioned 3 questions and 5 sub questions in each, that means 15 sub questions. And I remember saying 1 or 2 sub questions were just not related to the scenario, they were just basic dentistry questions. So how does it matter which cluster it is being asked? A basic dental question. So don't go on the cluster, just focus on solving the question, because even if you knew this is from this cluster, how is that going to change your answer? You have to stick to what is being asked. Understood? Then out of 5 options, 2 were very similar and it was difficult to choose. Yes, it's like asking a child to choose between mother and father. Very difficult to choose. But if I ask a child, you want to buy something very expensive, you're going to ask mother or father, in case the mother is housewife. What should be your answer? Father. You are going to ask the child whom you are going to ask to cook food. What are you going to answer? Mother is the option, right? Though mother and father both are correct. This is what ADC is. So when you are confused between 2 options, read the question again. When I say read, I mean analyze the question. What exactly are they looking for? You'll get your answer. Like how I said probing and IOPA. Both options are very correct. So again, I read the question. Did they mention radiograph? No. Then radiograph becomes my answer. Had they given radiograph, what is my answer? Probing. Understood? So next question, if you all have, please ask. Let me see any other question which has been given. Aboriginal patient with rheumatic heart fever lives in rural area. Wow, this is like so much information on this question. Aboriginal. What does PG say about Aboriginal? That they will always require antibiotic prophylaxis. So my mind will automatically go there. With rheumatic heart fever, ADC is dishing out you the answer. In rural area, meaning he's not going to come for treatment often. So whatever it is, it has to be definitive treatment in that visit itself. You see, suddenly you filter out so many options just by the first line of the question. Does not speak proper English. Came with his son, 14-year-old, that could speak English. That means there is a translator present with the patient. He told the dentist his father has pain every now and then, but it doesn't affect his sleep. Means there is no pain at night. Every now and then means pain just in the day or probably while eating. The cold with badly carious lower post teeth. Somebody doesn't have the exact question, but it shows that in tooth number 37, it shows badly carious tissue growth inside the crown of the tooth. How would you carry on or proceed with the treatment? What did the son say? The father has pain now and then. Did he say he's in severe pain right now? No, so it's not an emergency. Understood? This is what analysis of the question means. In Aboriginal, a 14-year-old is considered mature. The question here is about the father, not the child. So this option is not for us. Relatives can't interpret in behalf of the patient. To a certain extent, true, but a son would know if the patient is in pain or not. Call for an interpreter for rescheduling. I can go with that option. Though I feel there would be a 5th option, but this is what currently the option is given to me. So I would say call for an interpreter for rescheduling. I would treat as that. But since I'm seeing the tooth that is having a badly carious tooth, it's important to treat that also. So the options are not complete, but amongst the options given to me, I'll go with the option D. Question about what would you treat the patient. First option is extraction, second is extraction and remove the tissue growth and send it to the lab to confirm your provisional diagnosis. Remove tissue and send to laboratory. I'm sure DNA option would be like first give antibiotic prophylaxis. So I will not choose option A, B or C. They are giving me the treatment, but none of them is mentioning that I'm supposed to give him antibiotics. He has rheumatic heart fever, is abortional. How can I treat him without anything? Plus, he's not emergency, so I don't have to treat him right now. Understood? Question on antibiotic prophylaxis dosage. Options are not given. So it's an incomplete question, but I hope you understood how to analyze this question. The question itself gave you so many answers. See, ADC exam, some questions are nice like this. They'll dish you out the answer. Take it, because there'll be questions which will be tough. You understood this question? Now when I explain you the concept, does it sound easy? Ma'am, kindly mention all the books once we are all familiar with Odell, TG and infection control guideline. Yes, these are the gold standard books. Read it. You people read it. You people don't analyze it. See, when you first read these books, like when I read first time, it was just a lot of information. I just read it. That's it. Second time when I read it, I was actually understanding something. Third time when I read it, I was like, oh, this is what they mean. Fourth and fifth time I could not read because I did not have time. But I understood in my memory capacity, in my third reading, what they mean. The concepts that I'm explaining is because of my third reading. If you expect yourself to gain this kind of understanding of concept in first reading, no, you cannot pass the exam. You have to read these books 5 times. Read it 5 times first. 3 months will go in that only. Odell is such a exhaustive book, like cases and so much of information in it. How can you remember in 1 or 2 reading? Only when you read it like so many times, you'll finally start understanding. Your brain will start connecting the dots, and that would help you in analysis. So first finish these 3 books. 80% of your paper would be solved in this. The rest 20% comes from Cameron. Certain chapters on trauma and pulp diagnosis. Walton, again the same thing. Langelis for radiograph, OPG errors and IOP errors. Yeah, these. Ortho a bit here and there from Cameron again, interceptive ortho. And if you are practicing in a clinic, start reading every OPG. If you have a pediatric dental friend, ask them to give you OPGs and start analyzing the age. Read the fluoride charts, eruption chart, the perio-staging guidelines. These are very important things. I have shared the fluoride chart, perio-staging guidelines, everything on this Facebook group. Go in the file section. Go in the previous post, you see. The Caries classification. I have shared the ICDA system. Somebody was asking me today, how do you read the chart? ICDA system is so easy. It is given the grading C1, C2, C3. See, if the caries... I'm saying this about the chart, okay? Take this as a clinician also, irrespective of the ADC exam. When you see caries in just 1/3 of the outer enamel, you never drill if there is no catch. You remineralize it. You ask the patient to maintain oral hygiene. It will get arrested. Caries in the complete width of the enamel, starting into dentine, just into dentine. On the X-ray, the bite when. Again, you do not read unless there is a catch. If the outer surface is intact and you see the caries entering just into the first inner third of the dentine, crossing the entire width of the enamel, again you just wait and observe. That is a C2. C3 is caries into crossing the 1/3 of the dentine but not crossing the 2/3 of the dentine. So it's in the middle of the dentine. Now it's probably not a hidden cavity. Okay. Meaning what? Probably there is a catch. If there is a catch, you have to treat. If there is no catch, still you wait and observe. You still don't treat. You apply CPP, ACP, you apply fluoride, you wait and watch. But once it crosses the inner 2/3 of the dentine, you have to treat the cavity ASAP. That is the C4 classification. So this is nicely mentioned in the chart. Mug up this chart. Write on Google caries in enamel. See what kind of radiographs are there. You will start analyzing and then you will start correlating. Then you don't have to mug up. Then immediately you will know. And this is what you should practice in your clinic also. Just because you see a small smooth surface carious lesion on the enamel and on the X-ray, it is not crossing the dentine, don't treat. That is aggressive dentistry, not conservative dentistry. Are you understanding my point? So I mentioned all the books basically. How to choose whether cold test or hot test has to be done. If the question has mentioned the patient is having pain on eating or drinking water, then you go with cold test. But if the question has specifically mentioned the patient is having pain on drinking hot tea, you go with a hot test, because if the pain has started with hot water, that means it's crossed the stage of irreversible pulpitis. Cold test will definitely give you a lasting pain, but it can be a sign of reversible and irreversible pulpitis both, because transient pain is possible. But hot test means 100% it's irreversible pulpitis going towards necrosis of the tooth. So hot test becomes more definitive. Cold test is to identify whether it's going towards irreversible, if it's a long lasting pain or not. Hot test is definitive, it is irreversible going to necrosis. So always hot test should be the answer if the question is mentioning hot. If the question is not mentioned anything, then you go with a cold test. Any other question, guys? I hope all the questions regarding the mentorship, the books have been answered. If no any other question, I'll wind up the session, and we'll be meeting on, then I guess in November. On 20th of October, I'll be releasing the sample mock test. You guys can solve it. I'll be answering the same mock test in November 1st week. Again, having a session like we had last time, analyzing the question, choosing why a particular option is right, why the others are not right. In the meanwhile, guys, don't waste your time on just blindly following a herd mentality. Read and study what is correct for you, not for the rest of the people. Don't have FOMO, that is fear of missing out. Oh, this mentor is teaching that, let me go and study from that. Is that even required for your exam? Because if that was correct and everybody who had taken mentorship of that mentor would have been passed. No, I don't coach, guys. I don't take mass classes. That is just a waste of time. You ask me your questions individually, I'll answer and clear your concept. But what I've told you to study, and when I'm giving you out a mock test and asking you to solve and revise it and see why you made a mistake, take that seriously. So somebody asked me a very interesting question. Doctor, how much is the pass percentage in your course? I was like, how much is the pass percentage of ADC, excuse me? Written exam, barely 10%. Practical exam, 2%. What should I say? My passing percentage is 100%? No, that's wrong. So I have had candidates who cleared in their first attempt, in their second attempt. I have candidates who did not clear in their first attempt. But it's not like they failed in all the clusters. They failed in one cluster or two cluster. Fair enough, you need to work on your concept. If you failed in one or two clusters, you also cleared one or two clusters. So it's not like I'm teaching something to you and only that is being asked in the exam. It's your understanding of the concept also. It's the way you perform under stress in the exam. All you guys who did not clear have given the exam know how exhaustive the exam is. You could have made a mistake. When I give out a mock test, you guys make so many mistakes in that. And then you tell me also, Doctor, oh, in my head it was this answer, but I marked it wrong. You could have done the same thing in exam. That's why I keep on saying practice. If you're not devoting enough time for the mock test, then you're bound to make mistake in your final exam. So understand this. Don't ask us silly questions like what is your pass percentage. This is not some like churning out IITians in something. These are not questions which have been asked before and will be keeping on repeatedly asked. ADC is smart. It reverts the question. That is why whenever I solve a question, I deliberately give you more scenarios of the same question and the same options, but the answer changes. This is what ADC does. You understand? I never ever ask you to mug up. I never ever ask you to that I've given you a compiled file and mug up this and this will come in the exam. No, never. This is not the pattern of the exam anymore. Are you understanding what I'm saying? Okay, I have new guidelines about referral. Well, I have given a document to my enrolled candidates about the code of ethics. If you get enrolled, you'll get that document. That's an important document. I cannot just give it out like that. You know, I've also done a lot of hard work in gathering the important things. Respect that, guys. Doctor, how to prepare perio? See, perio, you need to know aggressive periodontitis, chronic generalized periodontitis, and those charts which I have shared on the WhatsApp group and I've emailed to all the enrolled candidates. I've given it to them. Staging, you can get it on Google. It's not like it's something sacred and can be get through only me. You can just type on Google staging and grading of periodontitis. There are two charts. One is on staging and one is on grading. So it's mentioned stage 1, no cigarettes, no diabetes. Stage 2, less than 10 cigarettes. Stage 3, more than 10 cigarettes. Less than 5 teeth missing, more than 5 teeth missing. How much is the pocket loss? You have to mug up that table. And then you have to apply that table in the question that has been asked. So if a patient says that he just have 2 mm recession but he's taking more than 20 cigarettes, then he falls into grade C because it's more than 20 cigarettes, even though the recession is just 2 mm. Or if somebody says the recession is 5 mm but the patient is not taking any cigarettes, stage 2, grade 2, grade B basically, because there is recession but the patient is taking less than 10 cigarettes. Or there is no smoking, no cigarettes, but there is uncontrolled diabetes, then in grade C again. So you have to apply this filter and then answer the question, because the options will be very confusing. Stage 1 grade B, stage 2 grade C, like this question. And the patient got 5 teeth extracted, now which grade it belongs to. Very important. So if you mug up this table, which you can easily get on Google, or I think I have shared even in the post, in the starting post of my Facebook group, scroll through all the posts, you will get the charts. You will be able to answer this question. And if any confusion, just post it here. I'll answer it. Understood? That is how you read perio. ANUG, yeah, most importantly. ANUG will be asked, 100%. Acute necrotizing ulcerative gingivitis will always be asked. Stress and perio will always be asked. Smoking and perio will always be asked. Uncontrolled diabetes and perio will always be asked. Remember this. Then we go on to which question it is. Patient ethical guidelines according to Australian, that is code of ethics document, which as I mentioned, I've shared it already. Health insurance, again code of ethics will cover that. Consent guidelines, guardianship, again code of ethics will cover. Ma'am, please tell me the detailed info about your course. Could you tell me how to enroll? Oh my god. You know what? Let me read out what I'm going to give in the course and let's deal with it once and for all on the group. Let me read it out. If you email me, you'll get all the details, but let's just read it out today. Let me open my email. Let me go to, yeah. And let's open what I give it out. In the study course, you will have access to a detailed study plan for the exam. What is a study plan? I have precisely told you what to study on what days so you don't get bored, you don't get monotonous, and it keeps your study live and active. So I have like sorted out this many days you're going to study this book, this pages and this and that, like that, and when to solve the mock test. This is the study plan. If you fail to plan, you plan to fail. Understood? Golden words. Second, I will give you all the relevant study materials so you don't have to hunt here and there. If you have all the relevant study materials, good for you. So I'll be giving you books like Walton, Cameron, Code of Ethics, TG, Odell, Infection Control, Langeles, Cameron, etc. Most importantly, what you will get from me is doubt solving on one-on-one basis. You will have access to my WhatsApp number and you can always leave me your doubt, and by the end of the day, I will surely solve it, or maximum by the next day. I leave a voice note in detail explaining the doubt and the answer to it and why there should be this answer and not anything else. And I will also stimulate you to think about something if you are on a doubt, and then you automatically will come with an answer and you'll feel good about it. This is what my candidates told me. I will also be giving you 230 past paper questions, which are basic dental MCQ questions, which are asked in the exam as a part of scenario based questions like MRO and J, like questions like this. So there are 230 questions and I'm making more of them, which I think is appropriate for the exam, and I'll be sharing those as and when made. But at the present moment, you'll get at least 230 questions. Most importantly, what you'll be getting is 8 mock tests. 8 mock tests is equal to 520 scenario based questions. Each SBQ has 5 sub questions. If you have solved any one of my sample mock tests, you know what it is. So 8 mock tests, it gives you a real feel of the exam because you're sitting for 2 hours and solving them at a stretch. And then once you solve, it comes to me. I see it, I give you a feedback, I give all the answers and details. And then you can solve these mock tests as many times as you would like. Because the more you solve, the more you'll understand the question. Because you will make a mistake the first time. You'll make little less mistake the second time. Even lesser mistakes the third time, because you are now analyzing the question. And there is no way you will remember all the questions. 520 questions. Do you remember your own exam questions after 4 days of the exam? No, you don't. So every time you solve it, you'll be like, oh, I'm solving this again. So again, your mind will start thinking, which is good. And I'm also gathering this last exam conducted questions. Once I'm done, that would also be included in your course, so you don't have to pay for that. So again, you'll be having another 280 set of questions when I gathered all those questions. This is what you'll get in my course. Understood? How to enroll? You have to leave me an email on adcwrittenmocktest@gmail.com, or you WhatsApp me, and I will tell you what is the course fee. How long will you be enrolled till you clear your ADC part 1? I don't charge again in case you don't clear, because like I said, I can guide you, I can explain you the concept. When it comes to attempting the question, it's you. If you know the answer, still you attempt it wrong, how does it reflect on the mentor? I guided you, I'm giving you mock test, I'm giving you time to practice, I'm here to solve your doubts, but practicing and analyzing comes from you and the strength of your concepts. Is that understood? So I'll be there until you can clear your part 1 exam, no matter how many attempts it takes. Understood? Is that clear? So I think we are done. It's already been like almost 50 minutes. Any other question, guys? Or should I wind up the session? I hope a lot of things are cleared up now. Write something, guys. No comments coming in, so I think I'll just wind up then. Okay, so have a nice day, guys. Any other questions that you have, just leave me a WhatsApp. And now you know why don't I like open a study group, even though on my WhatsApp group I have currently 495 candidates. Even in this Facebook we have like more than 1,000 members. You see, this is what happens when I allow everybody to post a comment. People here try to sell off courses from other mentors, which is not professional. Like, I mean, I cannot teach you that. It has to come from within. So, anybody who's serious, enroll in the course, start studying. Anybody has a doubt or a question, when I'll be holding the sessions when I'll be solving the sample mock test questions myself, which would be like once or twice a month. You ask me your questions, even though you're not enrolled, I'll be happy to answer like I'm answering right now. So I hope this helps. Take care. Good night, guys. Thank you. Makes me feel good after having sleepless nights. You know what? Since my son is an infant, it's been like months and I have not slept for 6 hours straight. So thank you for this comment. You're looking beautiful because I'm dead tired from inside. But I love to teach. I love to work. And that's why I'm game for it. And I love my son. So again, I'm game for it. Like he lets me sleep 3.5 hours, 4 hours at a stretch because he gets up for his feet. And then I wake up and I'm like a zombie. But it's okay. Let's just enjoy your exam, enjoy your study. This time is not going to come back, so don't take stress and study. Like if you take it as a task, it's not going to happen. Enjoy, learning will never go waste. Even if you don't clear, it's okay, it's absolutely okay. So hard work is going to come back to you in some or the other way. Trust me, I believe in this. It has happened to me. It will happen to you also. Have faith. Good night.